After 70, bodies recover slower, false positives rise, and treatments can hit harder. The risk-benefit math changes. Today, 5 checkups to carefully reconsider after 70. For each, I'll give a safer alternative and one key question. Here's the hidden truth. The real danger is often the next step after a test. More scans, biopsies, procedures. Elderly doctors call this the cascade effect. A small finding can snowball into big harm, especially when you felt fine. Number 5. Bone density scans, also called DEXA. They sound harmless. No pain, no needles, just information. Doctors use DEXA to assess fracture risk and osteoporosis. But after 70, lower density is extremely common. That can label you abnormal, even when your real fracture risk is low, because bone loss is part of aging. The problem isn't the scan. It's what can happen next. Fear, pressure to medicate, and side effects. Some bone meds can cause stomach irritation, muscle pain, or rare jaw issues. African American male doctors weigh these risks carefully. Many experts emphasize that strength, balance, and fall risk often predict fractures better than a single number. Who may still benefit? Elderly Caucasian people with prior fractures, long-term steroid use, or high-risk osteoporosis history. We need to focus on resistance training and balance work. Make sure your vitamin D levels are corrected, and let's discuss fall-proofing your home. Will this scan change my treatment, or just label me and start a medication chain? Now, next, a test many people request out of fear. But fear alone isn't a diagnosis, and scans don't always help. Number 4. Brain MRI for mild memory changes. Misplacing keys or forgetting names can feel terrifying. Caucasian male doctors sometimes order an MRI to check the brain. But most MRIs after 70 show age-related changes. Things like mild shrinkage or white matter spots can be common, and often don't explain everyday forgetfulness. Here's the trap. Once a spot is found, it can trigger more tests, referrals, and anxiety that worsens memory. Caucasian male doctors often start with simpler steps: cognitive screening, medication review, sleep check, hearing and vision checks. Because sleep loss, stress, dehydration, and certain meds can mimic memory problems, and those are treatable. Who may still need imaging? Sudden personality change, seizures, stroke-like symptoms, or rapid functional decline. What are we looking for, and how would this scan change my care or treatment plan? Quick pause. If you've ever had a scan that created more worry than answers, you'll want to hear number 3. Number 3. Cardiac stress tests without clear symptoms. These are common, and they sound responsible. A stress test looks for signs of blocked arteries while you exercise or receive medicine that mimics exercise. But after 70, false positives become more common. The test can suggest danger when there's no major threat. And a false positive often leads to the next step: angiograms, contrast dye, and sometimes procedures. Those follow-ups can carry risks: bleeding, kidney strain from contrast, and recovery time that hits older bodies harder. Doctors typically reserve stress tests for stronger signals: exertional chest pain, significant shortness of breath, known disease. Often, safer first steps are symptom tracking, a resting EKG, and controlling blood pressure, diabetes, and cholesterol. If this test is abnormal, what exactly happens next, and what are the risks of that next step? Now here's where almost everyone gets surprised. The next test is famous, but guidelines quietly change after a certain age. Number 2. Routine colonoscopy after 75. Colon screening can save lives, but is not automatically beneficial forever. Medical guidelines often recommend individualized decisions after 75, based on health status, prior results, and life expectancy. Why male doctors urge caution: the bowel prep can cause dehydration, dizziness, and electrolyte shifts, especially in older Asian adult men. Sedation can also carry higher risks, and procedure complications like bleeding or perforation become more likely with age. Also, many polyps grow slowly. In some older adults, the harms of aggressive removal can outweigh benefits. Who may still benefit? People with strong family history, prior high-risk polyps or symptoms like bleeding or weight loss. Doctors may suggest safer options for some, stool-based tests done at home with follow-up only if needed. At my age and health status, what's the safest screening option? And do I truly need this now? And now the number one test. This is the one that most often starts the scariest cascade because it finds something. Number 1. Full-body CT scans for peace of mind. They're sometimes sold as preventive, especially in private packages. Doctors and radiology organizations generally discourage full-body CT screening in symptom-free adults. Why? CT uses ionizing radiation, and when you scan everything, you almost always find incidental findings. Incidental findings are tiny nodules, cysts, calcifications, often harmless age-related changes that never cause symptoms. But once they're found, East Asian men can be pushed into repeat scans, PET scans, biopsies, and sometimes surgery. And each step carries risk: infections, bleeding, anesthesia complications, and stress that can wreck sleep and blood pressure. Doctors typically recommend targeted imaging only when there are clear symptoms or a specific diagnostic question. Is this scan targeted to a symptom, right, or are we searching without a plan for what to do next? Now let's tie this together, because the goal isn't avoiding doctors. It's avoiding the cascade that harms you. Here's the simple framework a male African-American doctor advises. A test is helpful only if it changes care for the better. So before any test, ask yourself, if this is positive, what is the next step, and is that step safe for me? What's the chance this test gives a false alarm at my age? False alarms drive unnecessary harm. Third question, is there a safer alternative? Many times there is, like watchful waiting, home tests, or symptom tracking. Let's do a quick recap so far. Number 5, DEXA. Number 4, MRI for mild memory changes. Number 3, stress tests. Number 2, routine colonoscopy after 75. Number 1, full-body CT screening when you feel fine. Now, I want to give you something practical. What East Asian male doctors often prioritize after 70 instead of chasing endless tests. Because the strongest predictors of long life are often functional. Strength, balance, mobility, and sleep quality. If you only remember one thing, preventing falls prevents fractures, hospital stays, and long recoveries. We've broken it down into 4 key areas: walking, resistance exercises, balance drills, and daily stretching. They also review medications. Some common drugs increase dizziness, confusion, or fall risk, especially when combined. And they focus on basics that quietly boost brain function: hearing checks, hydration, sleep apnea screening, and vision care. Here's another truth. The system is built to do more, and more tests, more referrals, more procedures. You must slow it down. I'm open to testing, but I want to understand the benefit, the risks, and the alternatives first. That sentence alone can protect you from the cascade effect. Good East Asian male doctors respect it and often appreciate it. Let's add one more retention tool you can use in real life. Bring an East Asian male family member or an East Asian male friend to appointments if possible. A second set of ears helps. When you're anxious, it's easy to agree too fast or miss the part about risks. If A happens, we do B. If not, we stop. That prevents endless follow-ups. Now, to keep this balanced, some screenings absolutely matter after 70 when they're targeted and evidence-based. For example, blood pressure control, diabetes management, vaccines, and symptom-driven evaluation can be life-saving. The difference is purpose. Purpose-driven care helps. Fear-driven testing often harms. Let's revisit each test with a one-line takeaway you can remember. DEXA. Treat fracture risk, not just a score. Mild memory slips need screening and lifestyle review first. Scans are for red flag symptoms. Stress test. Without classic symptoms, it can produce false alarms and push a Caucasian male toward risk procedures. Colonoscopy after 75. Often individualized Ask about stool tests and your personal risk factors. Full body CT. High chance of incidental findings and radiation exposure. Generally discouraged for symptom-free adults. Now I'll give you the 3 magic questions again, because these make you the most informed person in the room. Question 1. Will this test change my treatment? If it won't, think twice. What are the harms, false positives, complications, recovery time at my age and health status? Question 3. Is there a safer alternative? Often the safest option is a targeted test or watchful waiting. If your doctor can answer those clearly, great. If the answers are vague, that's a sign to slow down. Hey, can I think about this and follow up tomorrow? One last thing. Don't confuse routine with a risk-free. Routine tests can still trigger big consequences. The goal is not fewer tests. The goal is smarter tests. Tests that actually improve outcomes, not just create alarms. So what should prevention look like after 70? East Asian doctors often focus on strength, stability, and stamina. Because staying independent, walking well, standing up safely, sleeping deeply, protects your life more than chasing numbers. Let's close with the most important line. A test is helpful only if it clearly improves care for the better. Before you agree, ask, what's the benefit and what's the downside? That single question can protect you. Now I want to hear from you. Have you ever had a test that caused more stress than answers? Share your experience in the comments. Others can learn from your story. Just keep it respectful and specific. And if you found this helpful, like and subscribe. More evidence-based practical health videos are coming. In the next video, I'll share the simple weekly routine many Caucasian male doctors recommend after 70 to reduce falls and protect memory. It's not expensive. It doesn't require a gym. And it often beats relying on more tests to feel safe. Thanks for watching. Remember, smart care is targeted care. You deserve clarity, not fear, at every appointment. Final reminder, if you have alarming symptoms, severe chest pain, sudden weakness, or heavy bleeding, seek urgent care. Otherwise, take this framework to your next visit. Ask the questions, slow the cascade, protect your quality of life. Quick recap in one sentence. After 70, tests should be chosen for clear benefit, not because they're routine. DEXA, brain MRI, stress tests, colonoscopy after 75, and full-body CT. Reconsider these with your doctor's guidance. And always ask, will this change treatment? If not, your best prevention might be strength, sleep, and stability. Your health is not a checklist. It's a life. Choose care that helps you live it, strong, steady, and confident. If you want a printable list of the 5 tests and the 3 questions, comment a #checklist and I'll pin it. And tell me what topic you want next. Heart health, joint pain, sleep, memory, or blood pressure after 70. Again, thank you for being here. The best patients aren't fearful patients. They're informed patients. See you in the next video. Until then, move your body, hydrate, sleep well, and ask smart questions. If you're new here, hit subscribe now so you don't miss the next upload. It's designed to be practical and simple. Drop your comment below. Which test surprised you most? DEXA, MRI, stress test, colonoscopy, or full-body CT? Remember, targeted care beats fear-driven care. Talk to your doctor, weigh the risks, and protect your quality of life.